Hi everyone, I'm Sanjida Chaudhary and welcome to MEMcast's PACES Resources. This session is aimed at candidates who are preparing for the PACES exam. In our last video, we covered the neurological station in the PACES exam, and in this video, we'll be demonstrating history-taking skills in the station 2. By the end of this video and with independent practice, we expect learners should be able to learn a structured and systematic approach for taking history. Organize their approach to each symptom, select a battery of questions, and address patients' ideas, concerns, and expectations. As a reminder, this is the mark sheet for history-taking station. Whilst taking history, you will be assessed on your ability to explore their presenting complaint, take relevant drug history, past medical history, and family history, as well as addressing their ideas, concerns, and expectations. You will also be assessed on maintaining patients' welfare throughout. Treat the patient with respect and sensitivity, ensuring their comfort, safety, and dignity at all times. You will have 20 minutes for the station, 15 of which will be taken by the history taking, with 5 minutes to present your case and discuss the case with your examiner. Hi, I'm Dr. Sanjida Chaudhary. I'm one of the doctors here. I've been here to see you. Can I confirm your name and date of birth, please?
Yeah.
Thank you. Can I know what brought you to the hospital?
Yeah, essentially about 4 days ago, I was leaving work after a very busy day, and I noticed I've got pins and needles in my feet. I just shrugged it off at the time and thought I've just sat funny at my desk. I've not got up and walked around enough. Didn't think any more about it. Went to work the next day and it was still there. So when I left work, I phoned up my diabetes nurse because I was also diagnosed with diabetes a couple of years ago. They didn't think it was diabetes related, and that evening after I got home, the pins and needles started spreading from my feet, sort of started spreading up my legs. So I went to the walk-in clinic that evening to see somebody about it, and was told it's fine, go and see your doctor in the morning, which I did. I saw my doctor. He was also not concerned and said, get some blood tests done, we'll see what's happening in a week's time. So that was yesterday, but since then the pins and needles have spread all the way up through my chest and now spreading down into my arms, and I don't want to have to wait another week. I'm concerned it's something more serious.
Yeah. So you said like the pins and needles started 4 days ago and it's gradually worsening, right? Have you ever had any such symptoms before?
I've had a couple of strange symptoms over the last couple of years. About 2 years ago, I was watching television on a Sunday afternoon and I suddenly got a very sharp shooting pain in my right eye. I went to my doctor in the morning. He referred me to the eye casualty department at the QMC. They took a look and said, you've got optic neuritis. So they said it was inflammation of the optical nerve at the back of the eye. There was nothing medically they could do to treat it, but it would resolve itself over time, which it did in sort of approximately 6 weeks. And then about a year ago, I was driving home from work and I suddenly got very bad double vision again in my right eye, to the point I actually had to close my eye to be able to drive home, which was obviously not particularly safe. So I went back to my doctors again the next day. He referred me back to the eye casualty department. They took a look and said, you've got this double vision, it will resolve itself over time. Again, there's nothing medically we can intervene with, but they gave me sort of a prism lens to put on my glasses so I could sort of see a bit better.
Yeah. So you had an episode of optic neuritis 2 years ago, which lasted for 6 weeks. Then another episode a year ago of blurred vision, which also lasted for around 6 weeks.
Yes.
Okay. Do you have any weakness at all at this moment?
Yes, I've noticed a bit of weakness on my right hand side, especially in my right hand, because I'm right-handed. I found it a bit more difficult to hold a pen to write with or sort of typing on a keyboard.
All right. Any weakness at all in the legs?
A little bit on my right side again, yes, but not sort of too noticeable.
Can you walk unaided?
Yes.
Okay. Right. Any other symptoms of your bowel and bladder?
Nope, they seem okay.
Okay. Right. And any other neurological symptom like headache?
Nothing more than usual, no.
Okay. Any problem with the memory?
Not as far as I know.
Okay. That's fine. And do you have any medical condition that you're aware of?
Yes, I'm a type 1 diabetic.
And do you take any regular medications for that?
Yes, I'm on insulin for that.
Okay. Do you take any other medication apart from insulin?
No.
Are you allergic to anything?
Yes, I'm allergic to penicillin.
Okay, right. Is there any medical condition that runs in the family?
Diabetes does down my mum's side. Her mother had it, and she was diagnosed shortly before she passed away with diabetes as well. And she also had MS.
So your mother had MS, that means multiple sclerosis. Okay. Is she alive?
No, she passed away, unfortunately,
How long ago?
about 10 years ago.
Okay. And do you smoke?
I don't.
Okay. Do you drink?
Socially, yes.
Okay. How much will you say in a week?
I don't know because I don't drink sort of every week. It's probably only once a month.
It's fine. And do you drive?
I do, yes.
Okay. Is there any history of any substance abuse or any illicit drug abuse?
No.
Okay. It's fine. And what do you do for work?
I'm a trainee accountant.
Okay. Is there anything that's impacting on your daily lifestyle? You said the hand weakness is impacting your gripping and writing. Other than that, anything?
So obviously it's a very strange sensation with the pins and needles. So I'm concerned it's something more serious. So I want to get it looked at as soon as possible.
Okay. So your primary concern is the pins and needles at this moment.
Yes.
Is there any other particular things that you're concerned about?
I'm concerned it could be potentially a neurological issue. Maybe something to do with the brain. I don't know.
Okay. Right. Okay. Now, so do you have any idea what it could be?
I'm not too sure really, no.
Okay, right. So there are a few possibilities that can happen, but if I briefly summarize the clinical condition, and please correct me if I'm wrong. So you have this pins and needle sensation which started with your legs and gradually spread up to your arms, and it started 4 days ago and gradually worsening. You had one episode of loss of vision in your right eye 2 years ago, which was diagnosed as optic neuritis, and it lasted for around 6 weeks. Then you had another episode of blurred vision 1 year ago, which lasted for around 6 weeks. This time you have presented with the pins and needles and also a bit of weakness in your right arm, which obviously impairs your writing and your gripping. Other than that, you don't have any other significant medical problem apart from your diabetes. You take insulin for that. You do not smoke. You're currently driving, and your family, your mother had multiple sclerosis, and she died 10 years ago of that. Okay. So am I wrong at any moment?
Nope, that's
okay.
Right.
And so there are a few possibilities that could be cause for your current condition. So one of the possibilities is multiple sclerosis. So have you had any idea about this?
So my mum also had it, but she managed it fairly well. So I do know a little bit about MS, but don't know any more than that.
Okay. So multiple sclerosis is an inflammatory condition that affects the brain, and it might present as such like episodic neurological symptoms. So we will arrange a brain scan to look for an inflammatory lesion in the brain, which might help us to confirm the diagnosis. We might also need to do a procedure called lumbar puncture at some point, just to take some fluid out from the back of your spine and send it for analysis. Also, I'd also arrange some blood tests today and see how it comes back. And I'll probably, after the MRI brain scan, I'll also arrange a follow-up appointment with you. Yeah, do you have any question till now?
I just want to find out what it is as soon as possible, and if there's anything any medication I can take to try and minimise what's going on. I want to start it as soon as possible.
Yeah, I think multiple sclerosis is a neuroinflammatory condition. It can present as relapse and remitting. So there are a few treatments which are available for that. So that can also control your symptoms, that can also reduce the frequency of the relapses.
Okay.
So we are not 100% confirmed that you have got multiple sclerosis yet. However, even if we confirm the diagnosis, there are potential treatment options for you.
Okay.
Yeah, and there are also some potential support groups that can help you with it.
Okay.
But I think we need to confirm the diagnosis first and take it from there. Do you have any other question for me?
No, just try and get it sorted out as soon as possible.
Yeah, of course. All right. Okay, then thank you so much for your time today.
Thank you.
Could you present your case, please?
Yes, thank you. Son is a 39 years old gentleman presented with pins and needle sensation in both of his legs. The pins and needle sensation in both legs gradually spread up to his chest and both arms, and it started 4 days ago and gradually worsening. He also has weakness in his right hand, which is hampering his gripping and writing. He had one episode of loss of vision in his right eye 2 years ago, which was diagnosed as optic neuritis and lasted for around 6 weeks. He had another episode of blurred vision 1 year ago, which lasted for around 6 weeks. This time, he does not have any other neurological symptom. His bowel and bladders are doing fine. He has no chest pain or palpitation or abdominal pain or diarrhea or vomiting. He has a significant family history of multiple sclerosis. His mother had multiple sclerosis and died 10 years ago. He does not smoke. He drinks occasionally. He is currently driving and working as a trainee accountant. He does not have any significant travel history. He is allergic to penicillin. He is diabetic and takes insulin for diabetes.
What would be your top differential?
So considering the episodic presentation of neurological symptom, I'll probably think of multiple sclerosis as my top differential. Also,
what other causes?
There are a few differentials in my mind. It could be neurosarcoidosis or Lyme's disease.
Okay. And how would you investigate this?
I'll firstly do a full body examination. I'll check the cranial nerves, upper limbs and lower limbs. I'll arrange some blood tests like full blood count, urea and electrolytes, liver function tests, clotting profile, proteins and blood glucose. I'll also do an ophthalmological examination just to check his visual field for the blurred vision. To confirm the diagnosis, I'll do an MRI brain scan with contrast to look for any inflammatory lesion in the brain. I'll also perform a lumbar puncture to send the CSF sample for routine analysis, especially the protein and oligoclonal bands. To pair with the CSF, I'll also send some blood for oligoclonal bands, protein and glucose. This time, some neurophysiological tests can also be helpful, like visual evoked potential, to confirm the diagnosis.
Okay, tell me more about the management of multiple sclerosis. What treatment options are there?
So, multiple sclerosis is a neuroinflammatory condition that can come as relapses. If he presents with a new relapse and if it's an acute phase, then I can consider corticosteroids for 3 to 5 days to tackle the inflammation. And I'll also consider some supportive treatment like physiotherapy and occupational therapy. If the relapses are frequent and disabling, then I'll consider to refer him to the MS-MDT team to consider the disease-modifying treatments.
Okay, tell me more about the disease-modifying treatments available.
There are few disease-modifying treatments available. In the first line, there are interferon beta and glatiramer acetate. For second line, there are fingolimod. For the third line, if the first line and second line treatments are failing and they're not responding to help with the symptoms and relapses, then we can consider the third lines, which are natalizumab, or which is called as Tysabri, teriflunomide, and also dimethyl fumarate.
Okay. Anything else you would want to add about the management of this patient?
So I'd like to address his symptoms. If he presents with spasticity, then I'll probably consider using a baclofen. If he presents with some urinary symptoms like retention or incontinence, then I'll probably consider some cholinergic treatments to help with the symptoms. At the same time, overall, I'd like to arrange physiotherapy and occupational therapy to support him.
Okay, thank you so much.
MEMcast have some other MRCP related material. There are MCQs and facts of the week over on our Instagram page at MEMcast, and we have weekly podcast episodes available on streaming platforms. Good luck with your exam preparations from everyone here at MEMcast.